I chose this picture because I feel that one can be very powerful in nursing. With that power comes a lot of responsibility and respect for the ability and responsibilities that you have. I also listed my credentials, which a lot of nurses, you'll see lots of letters behind their name, but a lot of times it's elusive to most people what they mean. So I just wrote it out there so that you could learn more about what those acronyms represent. But I'm very proud of them because they are hard earned. So I do always display them as is expected in my field. Okay. Did the slide shift for you? Yay. Okay. I think I got this now. Okay. So this is my educational journey. I started at San Fernando Elementary School. I grew up in San Fernando, lived here my whole life until I moved away for college. So San Fernando Elementary School, I went to San Fernando Junior High, which is now called San Fernando Middle School. And then I moved on to San Fernando High School, go Tigers. And it was a great experience, all of these schools. I had a really good experience. In school, I always tried my best. I always asked for help. Well, almost always. But it was important for me to do well in school. So these schools provided that opportunity to excel so that I can have opportunities for my future, such as going to college. So I went away to college to attend USF, University of San Francisco. Their School of Nursing program is 4 years. It's integrated with both the college required courses with nursing courses for all 4 years, including clinical assignments where I worked in various hospital and healthcare settings in the Bay Area. I worked as a nurse for about 20 years until I decided to go back to school to get my master's. It's not that I never thought about it before, but it just seemed like it wasn't the right time. I got married, I had kids, just a lot of life happened. So I actually didn't go back till 20 years after I completed my bachelor's, but I found out it was actually a good thing because I had a lot of experience to draw upon, and I had a lot of knowledge to use that prepared me to be successful in the master's program. So for nursing, I think it's a great thing to work for a while before going back to pursue higher degrees. So what inspired me to even go to college? Well, it always starts with my family, mi familia, very important. And my parents were a big part of that. They're both college graduates, the first of their family. And I was raised to see what opportunities they had because they went to college in comparison to others that I observed who did not. It could sometimes be a much harder life to find work and to provide without a college education. And I recognize the value in that. I also saw my older brother go off to college after high school. He went to UCLA. And so it even more got me going to know that, yeah, this is my path. This is what I need to do. So how did I pay for college? Because we all know that's a significant part about figuring out how we're going to get there, how we're going to stay there, how we're going to pay for it. And for myself, I actually chose to go to this private university, USF, because I really, really thought very highly of their nursing program. It is more expensive than other ways that I could have gone to school for nursing. So I did what I had to. So luckily, I'm very blessed that I was able to get help from my parents, but they told me they couldn't help me with everything. And that if I was going to go to this school, I needed to take some loans out on my own. So I did take out some loans. I had some small stipends and grants that I applied for. But then I definitely did need to work part-time while I was a student, which most people do, most students do, especially nowadays. And it's actually a good thing. It gets you away from your studies for a while. You're interacting with other people. So working part-time during college is actually a good way to go. Gives you some extra spending money too. Um, so I know I'm going through this a little quickly. It sounds like it was just a smooth road, but it really was not. Usually is not for most people. So just wanted to touch on my challenges that I learned from, that I try to improve upon, and that I still continue to do today. So for me, going from home, where I was always told where I needed to be and what time I needed to be there, and mom waking me up so I wasn't late, and food being ready for me, and pretty much I just go with the flow at home, right? Well, when you move away from home, you have to make your own flow, and you have to make sure that you're still meeting all your responsibilities and obligations and doing well in school, and of course having a good time. So all those things can be very challenging if you go away from school, or even if you don't, just your first time in college. So it's a lot of learning that takes place, but there's many resources that are available. And then, like Dolores mentioned, you make a lot of mistakes. I made a lot of mistakes, and I learned from those mistakes, and I think I'm a better person for it. So it also allows me to be able to share my experience with others who are students now, who might be feeling the same way. And I have that opportunity to know where they're coming from, share my experience, and share maybe some advice that I might have learned along the way. So how did I get to where I am now in my nursing career? I first went to, like I said, University of San Francisco to earn my bachelor's. That's a 4-year program. Many people can be nurses in 2 years, but they will not have a college degree. They'll have a license and a certificate, but they will not have a college degree, and it can limit your opportunities and your pay for that are available in the field of nursing. And like I mentioned, I then went forward 20 years later to get my master's. And again, it affords more opportunities, a higher level of learning and experience. I had already experienced so much as a nurse before entering the master's program, but once in the master's program, I found out that all my experiences were actually very valuable, and that it was a good thing that I was taking that next step, because I would be able to be more effective for my patients, for the staff I led. So I am really glad that I took the dive and completed the master's. I did that in 2 years, and I did that online, which was very different for me from my bachelor's program, but it actually worked out well given my circumstances of having kids and having a full-time job at the same time. So that was my educational road. And then my career path, my job path, actually. I first worked right out of college. Well, it took me about 4 or 5 months to find a job, because at that time, nursing jobs for brand new grads were very obscure. It was very difficult to get a foot in the door. But I found a job here at St. John's Regional Medical Center in Oxnard. So it was quite a long drive from San Fernando, but I did 12-hour shifts. So I worked 3 times a week. So it wasn't too bad. But more than that, I learned so much, because I was on a floor of patients who were very, very ill. And I just learned so much from that experience that I never would have been able to had I not spent that time on that particular unit. Then I decided to look elsewhere. I wanted to see how I could be caring for people outside the hospital before they got super sick. And so one of the ways, my first foot out the door, was to work with American Red Cross, doing blood banking. So I was a supervisor on a team of medical assistants. We would go to schools, businesses, sometimes work on a bus that looked like this, to educate people about blood donation and to ensure that we were collecting a safe supply of blood and caring for the people who have decided to help out in this really important way. Blood donation is very important. It's irreplaceable. We count on people of their own volunteer to come forward and donate. So I always cheer and advocate for that. Then I went to work for HRC Fertility, which was a private practice that helped patients build families by getting pregnant. So it was a reproductive endocrinology practice. So I learned a lot about reproductive medicine. I worked with patients who were going through IVF, patients who needed to work with a surrogate in order to have a child, or an egg donor in order to have a child. Many different ways to build a family. And this practice was one of those places where people could go. And I found it fascinating, absolutely rewarding. And I really liked it there. So I stayed there about 5 years until I was recruited by Cedars-Sinai's reproductive medicine unit. They needed somebody with my experience. And I felt that going to work for a large organization like Cedars-Sinai I would be able to access even more opportunities than what this small private practice could offer me. So it felt like a good professional move to go there, and it was. I loved working there. I was able to use a lot of the experience I achieved at HRC Fertility to apply to this position. And then I learned a lot more and gained more skills. But it is quite far away from the Valley, and it's a pretty stressful drive. And I noticed it was taking a toll on my body, on my time with my children. By this time I had 2 children. And the great thing about nursing is that there's so many ways to move about that field and to move into positions that work for your stage of life, for your circumstances. There's something for everyone in nursing. So I decided then to look for something closer to home, which brought me to Providence Medical Institute in West Hills. Much closer drive. I was a happier person and able to be home more. And I was a supervisor in a primary care practice. And I really enjoyed it there. But I was still looking for something different, something more. And I found an opening at CSUN. They were needing a lead RN at the Klotz Student Health Center on campus. And up to this point, believe it or not, when I looked at the job description, I was able to check all those boxes because of all the experience that I had gained up to that point. And it was only because of those experiences that I was qualified and very excited actually about joining this team. So I currently work here full time. It's a joy to be in an environment where there's learning and energy and young people, and there's just so many opportunities to help and to care and to teach and coach. It's a thriving environment that I love to be in. So this is my full-time job. Michelle did mention that I have an entrepreneur business going on. And when I worked in the fertility, there was a great need for patients who are not comfortable doing their own injections at home. And they had to do their injections at home because they were done in the evening. It was not something that they went to the doctor's office to do. So I saw this need and I found opportunities to offer my services. And so it started out first as a volunteer-like thing, and then people wanted to pay me. So I thought, maybe these are skills that I should be compensated for. And so I developed a business, and my business is Confidential Nursing Care. I have a website, and I offer not only a service of going to people's homes to administer their injections, but also offer services of support, educating them about the process, because many times they don't have the time with their physicians or their nursing team to get that one-on-one attention that they really need, because it's an incredible journey to go through a fertility treatment, and it takes a lot of toll on the person as a whole, on their family, on their financial situation, just in all areas of their life. So I felt that I was very effective in that manner, and so I developed my business from there. And it works for me because it works in the evening hours after I'm finished with work. It's not every day. It's now and then as people need me and as I'm available. And I've been doing that for, gosh, probably almost 10 years now. And it's been very helpful for my financial situation as well. So I stumbled upon it, but I love it. And it's also a way that I was able to stay in the reproductive medicine arena, even though I'm working in student health and public health right now. So that's a very short snapshot, very quickly, but I wanted to leave plenty of time for questions. So I'm very open and honest. You can ask me anything you want, and I am here for you right now. So please go for it.
Well, thank you so much for all that great information. I know it inspired some questions. So feel free to type them in the chat, or old fashioned, you can raise your hand and we'll get started. Okay. Let's see.
Is anyone here thinking about going into nursing, or you've had an experience that maybe you're not sure if it would be something you'd be interested in, or any questions about the schooling process, or anything at all?
How did you know you wanted to pursue nursing?
I was very fortunate enough that from a very young age, as early as what I can remember, first grade, wanting to be a nurse. I know a lot of people struggle with trying to figure out what they want to do, even well into adulthood. So that's why I say I feel blessed, because it's always been an interest, then it became a calling, and it really is a blessing for me. But yeah, at that young age, I remember going to the doctor, and I remember it being a positive experience. I was intrigued by the buzz of energy, the different people that were there, the instruments, and the environment itself was exciting to me. And then as I got older, the science and health science part of it really intrigued me and was fascinating for me. And then I think just deep inside, I get a deep satisfaction of caring for people, helping people feel better, making a difference. And so for me, nursing encompassed all those things. And it has done that for ever since I can remember. So yeah, I hope that answers the question.
Okay, let's see. Blanca has a question. Nursing is very competitive. What advice would you give students to be more competitive?
Yes, that's what I'm understanding, is that there are long wait lists to get into some nursing schools right now. And that could be very deterring to people. I can understand that. I believe that if you really are looking toward that, and you've heard the stories of the long waiting lists and everything, sometimes you can take steps before you even begin to apply. If you already know you want to go on that track, there are programs you can volunteer for in the health sciences, either through hospitals. You can ask them. A lot of hospitals have programs for students right now that are both learning and working within the hospital. But most of all, you really need to make sure that your grades reflect your commitment to the field, because it is a difficult program. It's not impossible. You can do it, but you really have to put the commitment toward studying, asking for help, really striving to get the best grades you can. And then on top of that, just making use of time that you have to look for volunteer opportunities and just be involved, because I believe that when the nursing schools are looking at the applicants, they want to see, does this person have involvement in other areas, and not necessarily nursing related, just in terms of being a fuller person to have qualities to offer that would enhance them as a nurse. But yeah, there's long wait lists, and it can be sometimes just a matter of waiting and patience, unfortunately.
Thank you. Jennifer also has a question. What keeps you motivated? What has kept you also motivated?
Sure. There can be a lot of difficult days, as rewarding as and positive as I'm presenting it to be. There can be many difficult days or periods of time where you feel maybe a little defeated because you feel like your efforts are not going as far as you want them to, or you're not feeling like you fit in the environment where you're working at. But the motivation is important. So as soon as I start to feel that little bit of dip in motivation, I know that it's time for me to look at what I'm doing and see if I need to make a change. So if I go back to when I was a lot younger, my motivation was what I wanted out of life later on. You know, I wanted my own car. I wanted freedom to go places. I wanted to travel. I wanted to buy my own things. And so that goal kept me motivated to do what I had to do very well in school. But as I got older, and I'm 47 now, that goal changes. And so that source of motivation changes. And so I knew later on that I wanted to be able to have a good career that could provide the financial means for me to take care of myself and my family, to be able to enjoy experiences and opportunities that I would need to be able to finance. And now I'm looking at my things that motivate me to be successful in my career are reasons that include, again, wanting to be able to serve my community. How can I do that best? Where can I do that best? Where can I be most effective? And how can I be responsible with the earnings that I have so that I can help other people? That means a lot to me, to be able to be in a position where I can help people. So the motivation, when it's low, sometimes I just have to remember what my ultimate goals are and what I'm doing at this time to get to those goals. And there's a lot that can be done, but I think part of it is recognizing and having those goals for where you're always working to strive to be.
Anybody else have a question? Okay, I do
have a question.
Oh,
sorry.
Go ahead. Go ahead, Melanie.
What are some negative attributes of working in that profession?
Negative attributes. There are many, just like in any profession, right? So in my experience, it depends on where you're working. So sometimes sometimes nurses who are in a poor or underserved community might have a lot of frustrations with access to resources, with access to the things that they need to be more effective in those communities, and that could be really frustrating. So you might have all the intentions that, great intentions in the world. You might have a plan, but sometimes, whether it's because of the insurance world, or it's because of our economy, or it's because of our leadership, that you're kind of limited as to what you can do, as to what you can achieve. So that's one thing. Probably another, I wouldn't say negative, but challenging thing is when you really are trying to make a difference for someone, to help someone, and they don't want to help themselves. That's really tough sometimes. But as I've had more experience and I get older, I've learned how to deal with that. I really don't think there's a lot of negatives, because as soon as something doesn't work for you in nursing, there's another way to go. There's always another way to go, another area of nursing, another type of position, another kind of shift. So whenever something's not working for you in nursing, there's always something else that will. So that's probably what I would say about that.
Thank you.
Great
Sure.
questions. Thank you so much. Thank you, Marisol, for
Sure.
sharing your wonderful world of nursing career with us, with all the practical and inspiring steps that you've taken to fulfill your dreams in this great, fascinating career with so many avenues that you can take.
There really are so many, and it's never a dull moment. There's always new information. There's always new, as we know, new things that come up, new ways to help people. It's always changing and always exciting, and you can always be a part of it in a way that fits for you.
Thank you. Thank you so much.
Let me put my email address if anybody has any other questions and you want to get a hold of me, or you have any advice, or just pick my brain or anything like that. I'm happy to be available. My email is the best way to reach me. We have 6 seconds. Marisol.garcia@c